That sounds delicious and the carbo loads I need. So South Africa, if you're just like me, head over to our Afternoon Express website and you can receive the recipe and ingredients list to be cooking along if you feel like amagwinya or even fed cooks if you're from the Free State or wherever you are in South Africa. Now, South Africa's response to COVID-19 will significantly change under Alert Level 3, as all but high-risk sectors of the economy will be allowed to resume operating. We chat to Dr. Ridwan Mia on what the effects and struggles are of COVID-19 on healthcare workers, especially now that we're moving into Level 3 of the national lockdown. We also chat to him about the do's and don'ts that are still unclear. Welcome to the Loft, Dr. Mia.
Thank you, Palisa. It's a pleasure to be here.
Doctor, you urge the public to stay safe, practice personal hygiene, and stay at home. So how has the national lockdown impacted you personally, and how are you coping with it?
Well, it's very difficult as a medical specialist, and I'm sure many of my colleagues will agree. We have had to modify how we practice. For the whole month of April, most of us had our rooms, our consulting rooms closed, and we had to postpone much of the surgeries and procedures that we had on our patients that were not life-threatening, even some of the cancers that could afford to wait a few weeks. In May, we picked up a little bit. We were having to do the social distancing even in our rooms with lots of perspex screens, gloving up, masks, having our patients behind screens most of the time. It's difficult when you have to get quite close to your patients. We've had to check them for their COVID status before being allowed to admit them. So there's lots more logistics involved. Difficult on our patients, even scheduling appointments so that there are never more than one or two patients in your waiting rooms at the same time, and having to pace yourself. So it's a little bit tough. Obviously, all our incomes have been slashed massively. So, whether we like it or not, as medical practitioners, we still operate as small businesses. We employ people. We interact with other professionals. We employ nurses and other professional therapists and so on, that have all had to be, to sit at home during this time. So it's been difficult, and we've had to modify as we went along. Initially, it was sitting at home and going in to do emergency procedures and coming back home and worrying about our families. None of us wanted to take the virus home to our families, especially the young kids and older people.
Yeah. Doctor, it seems like you are time and time again putting yourself at risk, but for the greater good of everyone. I can only imagine the amount of frustration that comes with people who are not abiding by the laws. So you even took to the public and told people and complained about those that are arrogant, entitled, and violate the lockdown for their own sanity. Now, what led to this frustrating statement?
Well, I think like many of our colleagues, this came out of discussions with many of our medical colleagues. We saw the lockdown as effectively a delaying procedure to allow a country like South Africa to prepare better for the surge in the number of cases that is going to come, for the avalanche of cases and potentially severe illness and hopefully not, but unfortunately we're going to see deaths as well. So this gave us a time to prepare our healthcare facilities, better prepare our workers, train all our healthcare workers better, and make sure that we have enough protective gear to be able to cope with the load. So, we all wanted to see the public rally around the healthcare workers and to protect our healthcare systems, both our state and private healthcare systems, so that we're best geared to fight this virus when we could. And we were all very disheartened to note that we lived in neighborhoods of reasonably privileged people who were taking it for granted. They were going out and about in the streets when they shouldn't have, and the answers we got when politely, we advised our neighbors and in a very neighborly way to say, please, let's try and observe the president's guidelines. They're there for all our good at the end of the day. And it protects our own most vulnerable people, our old, our elderly, our children. The answers we got was, well, we're doing this to preserve our own sanity, and these laws really don't apply to us. And then we saw the other extreme of our society. In the townships, we saw very poor people who were eking out a living, trying their best to abide by the rules. And look, some people, they just couldn't. And they had to go out and eke out a living somehow. And we really felt pity on those. So it even more exaggerated the point that people who could afford to sit home, to keep safe, to limit the spread of the virus, should have been, showing a spirit of Ubuntu, showing a spirit of caring about fellow human beings, our fellow South Africans, to stay home and abide by the regulations.
Yeah, I see that juxtaposition that you're dealing with and you're battling with, where some people on one end of the spectrum are abiding by the restrictions and another side just don't care. But thank you so much for still doing your part and spreading the positive message. Now, as a medical doctor, you've been giving most of your time to the well-being of South Africa through medical care. This must have rather tremendous and physical and emotional strain on you. So how do you manage this physical and emotional strain? And what advice do you have for other healthcare workers?
Well, I think, the priority is look after yourself so you can be strong and available for your patients. I've been doing gym sessions online with my trainer, via Zoom in the evenings or early in the mornings, which has been very helpful. So not going to the gym, but he's there on Zoom and he tells me what to do. And, that's one way to do it. Eat as healthy as possible, keep a good, healthy regimen going in your home as well. Everybody keeping fit, try and exercise in the hours that we're allowed to. But more importantly, exercise social distancing. When you have to go out to get your essentials, your groceries and what have you, try to exercise, all the precautions, keep the distance away from people you don't know that are not in your household, and wear your mask. And I would even go a step further to say try to wear a visor as well, because it's the visor that protects the eyes, which is another route of infection that we've noted. The mask will protect everybody else in case you are unfortunately going to be carrying the virus as well. So try and observe all those guidelines. And to add to it, many of us are not in the healthcare profession are not really on board when it comes to opening up our economy as much or as quickly. We're always going to be saying do it more slower. And I guess it's always going to be a compromise. So we're going to have to emphasize to people, even when you have, for example, leisure activities or religious activities being opened up, try to be as careful as possible. Please try and follow all the rules and please exercise social distancing as much as possible.
And practice those restrictions. Thank you so much, Dr. Mia, for shedding light on the virus that's changed so many aspects of our lives. We appreciate it, Doctor. Cheers.
It's my pleasure. All the best.
Coming up, we catch up with the bold Andisa Kunene about her striking African prince as we head into the end of Africa Month.